Hello, I'm Dr. Jaclyn Flanigan. I'm the Chief of Medical Oncology at Cape Cod Healthcare. So one of the reasons that oncology is such a fantastic field is because it's multidisciplinary and so many different types of providers have an opportunity to take care of our patients. As a medical oncologist, what we specifically do is we give treatments that can affect the entire body. So we're not doing any localized treatments such as surgery or radiation, but we're giving either pills such as oral chemotherapies, targeted pills, or intravenous therapies, chemotherapy, immunotherapy. And these are treatments that will impact the entire body and treat cancer within the entire body. And these treatments can either be given to help prevent cancer from coming back, or can be given to treat a cancer that a patient currently has. I have a particular interest in treating breast cancer. I also treat all sorts of malignancies, but my special interest is breast cancer. I think that what really drew me to it, which has drawn me to so much in oncology, is the patient relationships. And I just feel that with my breast cancer patients that we just have such a special connection. And it's just very natural for me to connect with these patients. And like all fields of oncology, there are so many advances, and I've just really enjoyed keeping up with the advances in breast cancer and the new treatments that we have available. And fortunately, at Cape Cod Hospital, we also have some clinical trials for breast cancer as well. There are always new drugs coming out in medical oncology, and it's really hard to keep up with them sometimes. And there are different types: traditional chemotherapies, combined chemotherapies, immunotherapy. And one of the exciting things is that drugs that are being tested or have been used in one setting, such as advanced disease, are now being extrapolated and used in studies to see if they can make a difference earlier, let's say in the neoadjuvant or adjuvant setting, to improve patients' outcomes. So we're doing so much more, I think, in the early breast cancer setting to try to really cure this disease and prevent recurrences. And we also have a lot of research related to breast cancer. I mean, this is going on everywhere, but we're so fortunate at Cape Cod Hospital to actually have 2 phase 3 clinical studies with breast cancer available for our patients. I decided at an early age that I was interested in going into medicine because naturally I have a deep desire to help people and I love science. So it was a natural fit, and I decided in high school that I wanted to be a physician. So initially I didn't think that I was going to be an oncologist. I had a lot of other interests, and it wasn't until I was a resident and I was rotating actually in the hospital on the oncology inpatient service that I got to spend a lot of time with oncology patients. And what really spoke to me was that their families were always there in the room around the clock. They were always excited and grateful to meet with a medical resident. And I felt that I was really making an impact in their lives. And after I did that inpatient rotation, I was told that if I enjoyed that I should spend time in the clinics, because oncology is largely an outpatient specialty. So then I went and I rotated in the specialty clinics, and I just fell in love with medical oncology and the patients. One of the fantastic things about medical oncology is that while I'm pivotal to a patient's care, so are so many of my team members. And it's not just about treating the disease, but the patient as a whole. And that requires other specialized services that we have at Cape Cod Healthcare. So this is in addition to other physicians on the team, such as our surgeons and radiation oncologists and radiologists and pathologists. But this is also our team members like our nutritionists. We have a partnership with the Cape Cod Collaborative, and we like to promote other holistic therapies such as acupuncture, massage, Reiki therapy. We have dedicated social workers. And my team on a daily basis also, I rely heavily on my practice nurse and the nurses in the treatment room. So it's far more than just me as a medical oncologist setting a plan for a patient. At the end of the day, there are some days that are better than others. And certainly in this job, we do deliver bad news sometimes. And at the end of the day, when I go home, what I need to tell myself so that I can have peace is that I treated everybody today the same way that I would want to be treated and the way that I would want my family members to be treated. And that guides me. When we first meet our patients, obviously there are so many questions, there's so much anxiety, people are so scared. And I find that our patients demonstrate such courage and such positivity even in the face of adversity, and it's really commendable. So we develop such close relationships with our patients, and I feel that I know so many patients and their family members on a level that I didn't know was possible. And it is such a special bond with these patients. So the relationship, I think, is the most rewarding thing. And then certainly when you have the opportunity to know these patients over years and to see success stories, there's just nothing else like that. So I have 2 daughters. We live in Sandwich. The girls are very busy with soccer. They do club soccer all year round. They also swim competitively all year round. So that leaves us with very few free weekends because we are at soccer matches and swim meets. In the winter, we like to ski. Fun fact, I'm from Florida and I learned to ski at age 40, so I'm not great at it.